My name is David Kirkpatrick. I'm going to be hosting the webinar tonight, and please ask questions and submit them because I do want you to get your time. I know time's valuable, and I want you to get your money's worth by being on here and listening to me tonight. So, couple of things. If you see my credentials, you see the DMD, that is my doctorate degree, and the FACS is something that I'm very proud of, and that is I'm a fellow of the American College of Surgeons, which takes a lot of extra work and a lot of extra training and then an extensive interview process, which I passed a few years ago, and that is important. All right, so I did all of my school at the University of Kentucky, which is where I'm from. I was born and raised in the state of Kentucky, and I did my surgery at University of Florida in Jacksonville. And that last highlighted area, which says I'm board certified oral and maxillofacial surgery, that is the most important thing that you'll hear about me tonight. So that is really important, whether you choose to see me or someone else. Make sure they're board certified, because it's the only way that we kind of regulate ourselves and make sure that when you're board certified, you are definitely keeping up with the standard of care and on top of all the safety standard and surgical protocol. So dental implants, they are recommended by our National Association as the best way to replace missing teeth, whether it's one tooth, couple teeth, or a mouthful of bad teeth. And for those of you that do not know, this is a picture of a dental implant. And you can see the silver structure, which is going into that yellow looking structure, which is meant to represent your jawbone. The silver screw looking structure is the implant. And then once the implant's placed, then a general dentist or us puts on like your full bridge or a single tooth or the crown. So this is what we do, and this is what we're going to be spending most of our time on. So this is a picture of what the New Teeth Now procedure looks like. And what you're looking at is basically the clear stuff that you see is representative of your upper jawbone, and then the bridge is the pink and the white, and the little, you can see the kind of the ghost appearances of the screw-shaped implants, and there's 6 of those, which is what I do on the upper jaw. That's also very important for you guys to hear. So there's a lot of people that try to do this on 4 implants on the top and the upper jaw. It's fine to do that on the bottom, on the lower jaw. With the upper jaw, we now know through extensive research that a lot of universities are doing, they have been doing, and they're still doing, show that you need a lot of support on the upper jaw, because there's a big difference between the quality of the bone of the upper jaw and the lower jaw. The upper jaw is a lot more spongy of a bone, where the lower jaw is really hard, dense bone, and 4 implants are fine on the lower, but 6 implants, you need 6 on the top. And sometimes I do 6 on the bottom. I try to do as many as I can, but keeping the implants spread out so they're not too close together, and the access holes that are in your bridge don't get too close together, because if they're too close, then there's not enough material in between, and you can have a breakage of the bridge. So this is what the lower would look like. You can see the 4 implants and the 2 on the back part, which are those angled ones. They're angled in the back, and that's to extend them back, but it also makes the support from an engineering standpoint a lot stronger. So a lot of before and after pictures today, and I think they do a little bit better job than me just sitting and telling you how pretty I can make your mouth look. These are patients that I've actually personally treated. So they're my personal patients, and they've all been through this New Teeth Now procedure. So you can see there's a huge difference. And that after picture that you see on the right, that's in his temporary teeth, which we'll get into that. But you basically get 2 sets of teeth with this New Teeth Now procedure. You get temporary teeth that are placed the same day that we do the surgery and put the implants in, and you wear those for 6 months while your implants are fusing with your bone. And then we start making and make your final set of teeth, which are, the final set is out of zirconia. There's a lot of reasons that we do that and make the 2 sets of teeth. The first one is we know that you go through a big healing process with your gums. They're going to shrink a little bit. So if we tried to put your final teeth on the same day or the next day, then a couple months from now, they're not going to fit very well. You're not going to be happy, and you're going to want your teeth remade. So we do 2 sets of teeth, and we wait to make the final once your gums have totally healed and gone through their shrinkage phase, and the implants have totally fused with the bone. So another one of my patients, you know, she was unfortunately involved in a car crash when she was around 16, 17 years of age, wore a snap-on denture over the top of those broken roots for years and years. And she just got tired of having this thing that was removable. So she came in to see if she was a candidate for implants. And she was, you know, and another comment that I'll throw out there is I've been here for 14 years now doing this. And I've yet to have a patient that was not a candidate from a bone standpoint to doing this procedure. That's her after. And that is a game-changing procedure for this lady. She went from having, you know, something that she didn't even want to smile with to something that she can act and treat more like her natural teeth. So another one of my patients, and he's in a surgery not too long ago. It's probably coming up on 4 or 5 months now. He's still in his temporary teeth. And he knew that he needed some help with a special type of implant that we do called a ZYGOMATIC implant, which I'm going to talk about a little bit more later on in the presentation. But essentially what we do with those ZYGOMATIC implants are for people like Juan. You know, he is from Chicago. He actually came down from Chicago to have me do his procedure because he couldn't find anyone up there to do the procedure for him. And because he did not have a lot of bone in his upper jaw. And when you don't have a lot of bone, you either need extensive bone grafting and extensive time for the graft to heal, or you do something called a zygomatic implant, which still lets us do the implants same day. You get your teeth the same day, and you avoid any bone grafting or the time for the bone graft to heal. So we actually have a video that I want to play where Juan kind of walks you through and talks about his procedure. And it's, in my opinion, it's really important to hear from some of our actual patients. So I'm going to go ahead and play that video. And then after the video, we'll continue the webinar.
Good morning. I woke up feeling extremely excited about my upcoming dental procedure. I'll be getting this done at New Teeth Now in Lakeland, Florida, with a wonderful staff and an incredible doctor, Dr. Kirkpatrick. I've been waiting for this for 35 years. I was born without 12 or more adult teeth. You know, it was very, very difficult as a child. You're always looking down, looking away. And as a result of going through that as a child, as an adult, suffer from depression and anxiety.
Okay, Juan. Yeah. Well,
oh boy. Oh my goodness. Being in a public setting, being able to meet new people, smile ear to ear, laugh at a joke without covering my mouth, looking down. I know every day I'm going to smile as big as I can for no reason because of New Teeth Now.
okay. So you can see the difference, and the after picture, that's Juan the same day that I did his surgery. So it's at the end of the day when we put in his temporary teeth. And I mean, it's a huge life-changing procedure for him. You heard his story and you can see his before and after. And that's something that basically he came in from Chicago. We had him set up for surgery a few days before, made his temporary teeth, which I use in surgery to guide me on the placement of the implants. So I took out all those teeth that you see on his before picture, got rid of all the infection, and I used a laser to do that. and then smooth any little rough edges, put the implants in, close everything, and put his new teeth in. And it's a pretty cool thing to be able to offer our patients. So why do people do this procedure? Well, number one, the goal should be to restore your total body health. We know that your mouth is actually connected to the rest of your body, which, you know, for a long time, primary care doctors sort of just overlooked that. They would have you really quickly open your mouth and say ah, and then they would, you know, examine the rest of your body. But, you know, now they're really teaching the primary care doctors to take really good looks in the mouth. And if they see red, bleeding gums, irritated gums, swelling, a lot of decay, they're going to highly recommend that you seek the care or the opinion of a general dentist, because they know that there's a big connection between the health of your mouth and the health of the rest of the body. Another reason is improve your self-confidence. Most of our patients, they have a huge self-confident problem. You know, they're ashamed to smile. It's routine for us to hear them say that, you know, they'll be out to dinner with friends or family, and they'll put their hand over their mouth when they're talking, just because they're embarrassed about what their teeth look like. So it definitely helps bring out a smile, and it improves your ability to eat without pain. A lot of our patients, when they're chewing, and if they have a lot of recession or a lot of decay, then it hurts when foods are too cold, too hot, or even sugary foods causes a lot of sensitivity. For the people that are really scared of the dentist or worried about the procedure, we do this under general anesthesia, so you're asleep during the entire procedure. And the postoperative pain level, I promise, will surprise you. It does us, well, it really doesn't anymore, but considering the amount of work that we're doing on our patients in one day, you know, for them to tell us that, well, I mean, I took some Advil or Tylenol, but the pain medicine you gave me, I took one because I was scared I was going to be in pain, but then I never needed any other pain pills. So that's a really cool thing. So the mouth is the gateway to an awesome creation. That's one of my personal favorite quotes. And, you know, if you look at that chart, you can see how periodontal disease is related to a lot of the other part of the body. But, you know, the big ones are, it increases your chance of heart attack. You know, that's a huge connection. It increases your chance to have a stroke, increases your risk of osteoporosis, digestive diseases, respiratory diseases, diabetes, and what all these things, when you add them up, the longer you're fighting this low-grade chronic infection called periodontal disease, then the more your immune system is working, and the more your immune system works, or if it's working too hard, then it will shorten your life expectancy. So it is very, very important to make sure that your mouth is in a healthy status. And here's what, you know, this is what we routinely see. You know, in that picture on the left, you know, that's periodontal disease. And in my opinion, from what we typically see, that's not bad. You know, that may look gross to you guys, but, you know, what you see there, you can see the more of the white part is the crowns of the teeth, the yellowish brown stuff. That's the roots of the teeth where he's got periodontal disease, which made the gums and the bone shrink. And he's got some decay. He's got some missing teeth, some failing dental restorations. And what I did, took everything out, smoothed down any rough edges, got rid of the infection, put all new implants in, and you can see that same day, he's still asleep. That's what I did. That's, you know, you can see the stitches in his mouth, the little silver structures coming through the gums. Those are the impression posts, which we use to guide where the implants are coming out of the bridges at. Those come off when we connect the bridge at the end of the day. They just screw off. But that's what he looked like before he woke up. This is what he looked like about 3 weeks after surgery. And you can see gums are perfect. They're pink, they're healthy, there's no infection, no recession, and no decay. And that's him about 3 weeks after his procedure. So you can see just a huge difference in basically the appearance and how he feels. He has no more pain when he's eating. He's not ashamed to smile anymore. He doesn't have to wear his little flipper that had the one tooth on it, which is like a retainer that he would snap in and out to replace that front tooth. Now everything is secured, it's screwed in his mouth. He can't take it in and out, and it's one big bridge. So if you want to be truly healthy, you must restore your oral health. So who's a candidate for this? Well, if you have no teeth or you're unhappy with your dentures, you're a candidate. If you have a mouthful of bad teeth, you're definitely a candidate. If you have severe periodontal disease, I would urge you to seek the care of me or someone like me. And if you've ever been told that you do not have enough bone for implants, then 100% you need to come see only me, because it's routine for me to hear, well, you know, I saw an oral surgeon 5 years ago somewhere else. I saw an oral surgeon again 3 years ago, and I keep being told that I don't have enough bone for implants. And then these patients walk in to see me, and I take a CT scan, which you definitely need to try to treatment plan for this procedure. And I look at it and it's like, oh, well, you may need the help from zygomatic implants in the back part of the upper jaw, but other than that, you've got great bone and we can do this. And sometimes people look at me like I'm crazy, like, are you sure? Because 3 other oral surgeons told me I didn't have enough bone. And like I said when we started, I've never had a patient that I couldn't do this procedure on. So meet Willie, another one of my patients. You know, you can see he's got a lot going on. He's got a real gummy smile. He's got missing teeth. He's got infection, that little brown dot that you see on his gums. That's where infection's draining out from one tooth through his bone, through his gums. And then you can see all the gaps in between the teeth. That's periodontal disease, where the teeth are moving, they're loose. We took everything out, put in implants, new teeth on the same day. And this is him about 3 weeks after his surgery. That's an incredible change, totally changed his life. He loves the teeth, and you know, he had a really outgoing personality before, but now he's wanting to smile and show everybody his teeth. This lady came in, you know, her teeth on the left, the before picture, they don't look that bad because it's a denture, but she has no teeth. And she was told that she didn't have enough bone for implants to just get used to her denture, and that's the way life was going to be. And she kind of took that to heart for a few years. And then she kept seeing our commercials. She thought, well, I'm going to go in see one more person and see if Kirkpatrick can help me. She had plenty of bone for the implants. We threw away her denture. We put in the implants. And that's her after picture with a fixed set of bridges in her mouth. The roof of the mouth is not covered. She doesn't have those wings that the denture had going underneath her lips or in between her cheeks. And for those of you who have dentures, or you have a family member or a friend that has a denture, you know exactly what I'm talking about. They're big, they're bulky, no one likes them, and we can help you with that. Another lady, the picture that you can see her smiling, that's her denture. You can see the upper jaw has no teeth. It's really flat. She hardly has any bone. 2 failing implants on the lower that she was using to snap a denture over that was, you know, trying to give her some retention and help her retain the denture. It was getting harder and harder for her to wear a denture on the upper jaw. So she came in. She needed help with some zygomatic implants, and which a lot of our patients do. And we were able to put the implants in, and that's her after picture with implant retained fixed bridges that she cannot take in and out. They're screwed in. They never come out unless I or a general dentist unscrew them and take them out. And she treats them like natural teeth. You brush them, toothbrush, toothpaste, and you know, you're able to chew and eat basically anything you want to. Another before and after, you know, this lady came down from Philadelphia to see me, knew she didn't have a lot of bone in the back part of the upper jaw. She knew she either needed significant bone grafting or zygomatic implants, and she did not want to go through someone taking bone from her, possibly her hip or leg, to put in her upper jaw. So she wanted to come down and see me, and she was a candidate for this. So we were able to take out all those teeth, which was one big failing bridge, put in these implants, and you can see those longer implants that are angled on both the right and the left sides of the x-ray picture. Those are the zygomatic implants. They anchor into the lower part of the cheekbone, bypasses the area where you don't have a lot of bone, and it enables us to put these teeth on the same day. And by the way, those implants are super strong once they anchor into that lower part of the cheekbone and what little bone you have in the upper jaw. They're very strong, a lot stronger in my hands than what implants in grafted bone would be. And you can see her after picture there where she is super happy. They look great. And, you know, she picked out, which I will make that comment, her teeth are really white. I think they look great. She loved them. But a lot of people don't pick that. And a lot of people don't think that looks good. They don't like that really white appearance of the teeth. They think they look fake. I think they look great. But that's the advantage of you being the patient. You get to pick out what your teeth, what you want them to look like. So here's a before and an after, and this is called a quad zygomatic case, where you basically have no bone in the upper jaw. And I was able to find a little bit pretty much in the middle part, and that's what you see, that really short implant. So when we do quad zygomatic implants, when we have 4 implants anchored into your cheekbone and the jaw, then that's the only time that I possibly may not do 6 implants. All the other times, my patients are getting 6 implants. But with these quad zygomatic implants, they are, again, really strong, really supportive. And that's the only time that, in my opinion, that it is strong enough to not have 6. So another one of my patients, she's very dear to all of us at the office. And, you know, we get to know you as a patient when you come in. It's not just, you know, oh, you're here, you're going to see me for a consult, and one of my partners for your surgery, and then someone else for your post-op appointments. You get to know us, we get to know you. And, you know, Bethany came down. She actually came from my home state in Kentucky, but she had seen us through the internet, somehow found us through the internet. And she is a YouTube star. So many of you, if you look her up, and I think there's a link on our website that you can get to her, but she pretty much has described her story through YouTube videos about what she went through as a kid. And she was born with an awful disease where, from a oral and facial standpoint, her bones didn't grow properly. She had several teeth that didn't form, and the ones that did form were so bad they had to be removed. So she was actually in a denture as a kid. And we're going to hear Bethany's story, and then we'll continue.
I had looked into dental implants before, but I had so much bone loss from having dentures that it just didn't look doable for me anymore. When I was 8, I got dentures, and it looked awful.
And the longer you have a denture, the more bone loss you have. And when you have a lot of bone loss in the back part of the upper jaw, you either have to go through extensive surgery with bone grafting, and you let that bone graft heal, or you can use zygomatic implants and kind of do everything in one day. We were able to put 4 across the front, and then the 2 zygomas in the upper jaw. And on the lower jaw, I typically do 4 implants for the entire bridge, but she had enough that we could squeeze in 6. It's a great feeling just knowing that in one day can make that big of a difference in a patient's life. We all want to see.
Okay. Wow.
They look good.
They look so great. I'd say there's definitely hope. If you think that you can't have dental implants, like, obviously you definitely can. Now, thanks to Dr. Kirkpatrick, I actually feel free to smile freely, and I can eat whatever I want.
Okay, so there's Bethany's before and after. And you heard part of her story. You know, it was really cool to be able to be the surgeon that got to treat her and help her through part of her journey. But, you know, just a huge change. She's got, and even the after picture, just a big improvement. And one thing I did not mention before, but, you know, for people who have dentures or been missing teeth for a long time, or a lot of periodontal disease, you know, you start to lose part of the jawbone, which starts to, you know, affect your facial appearance. And you get that sunken in appearance. And a lot of times with these implants and these full bridges, when you put the teeth back where they should be or where they normally should be, it does restore a lot of that lost volume. So just looking at her face, I mean, she looks different, and that's because of her implants in those bridges. So another part of my practice that a lot of people get interested in when they start talking about doing this procedure is, I do full face cosmetics. That includes chin and cheek implants, and I'm talking about not dental implants. These are silicone implants to, basically give you a stronger chin, give you more defined cheeks from a cosmetic standpoint, brow lifts, eyelid enhancement, where we would do blepharoplasties and, do surgery on the eyelids, facelifts, neck lifts, neck liposuction with, a neck lift, and lip lift. For those of you who your lips have thinned out over time, then we can do basically a lip lift. And that's something that we can easily do at the same time as this procedure. And also rhinoplasty, which is basically a nose job. So a CO2 laser, it's a really cool additive that we can do at the same time of these procedures. And this patient came in, she primarily came in because she was interested in having all of her teeth out. She had periodontal disease and had been told that she needed all of her teeth out and dentures put in. She did not want dentures. So she came in to see if she was a candidate for implants. And while she was here, she found out that I do cosmetics and was asking about what she could do about those sunspots and some of her fine lines and wrinkles. So basically, during one day, I was able to take out all her teeth, completely get rid of her periodontal disease, so she's infection-free, put the implants in, put the new teeth in, and did a CO2 laser resurfacing of her skin. So it removed instantly the sunspots, improved her fine lines and wrinkles. She's got a glow to her skin. The sunspots have pretty much all been removed, and big improvement in her fine lines and wrinkles of her face. And, that patient on the right looks like the patient on the left's younger sister. Just a big improvement. Facelift and neck lift. Another facelift and neck lift. And you can see just a big improvement. And what I try to do, though, one thing that you'll know when you come and talk to me and try to get, when you get to know me, you know my philosophy of practice, and I don't want to do anything that looks fake. So that old plastic surgery wind tunnel look, I was trained to not put patients through that. So I don't do that. I still want you to look natural, but I just want you to look like 20 years younger. And that's what I think that we accomplished with this lady. Chin implant, it's about a 30-minute procedure. You can see that before patient, she's got those dimplings on her chin. That's where she's straining that muscle to try to get her lips to close. And then on the picture on the right, she doesn't have to do that anymore. Stronger chin, big improvement. So with dental implants, they'll never need a root canal. You can see the before and after here. She's got multiple missing teeth, decayed teeth. She had all the above with crowns, fillings, root canals, and we ended up taking everything out, putting implants in, and that's her after picture. They will not decay. We get asked that question, believe it or not. So they're fake, so they will never decay. You don't need a root canal. They're very easy to maintain. You brush them, toothpaste, toothbrush, and you'll hear me talk a lot about water pick when you become a patient of mine. I'm a firm believer in using a water pick, even if you have natural teeth. It's a great thing to do. It doesn't take the place of flossing, but with implants, it's really good to water pick around the implants. And, this is what we can do. You can see her before and after. Donna's another one of our special patients that we just got to know really well on a personal level. And, she's so happy with her outcome that she's even willing, and she offers to personally speak to patients. So she wants us to give her phone number to anybody that's considering this, that, would like to speak to somebody who's had the procedure, and she'll walk you through the good and bad, the ugly of the procedure. So, you know, I would urge you that if you do want to talk to her and you're signing up for this, you know, give Donna a call. She'll walk you through exactly what she went through. So this is a really important slide. Everything is under one roof. You're not going to come here for the consult, and then we're not going to send you somewhere else to meet the lab technician, another place to meet the prosthodontist or the general dentist who make the teeth, and then to an oral surgery office. Everything is here. Your consult's done here. I'm your surgeon. I'm here. The impressions, the teeth are made here. The surgery's here. The lab is in-house, and your final teeth are made in our building. So basically, you come here and everything, you don't have to go to another office. That is super important. And if you've kind of pursued or talked to somebody about this in the past, you may know already how important it is for the lab technician to be able to walk out of their lab, come over to your room where you're at, talk to you about what you want your teeth to look like. They look at your face, they look at your skin tone, they look at the shape of your face. They can help design teeth which fit you, and that is, I mean, it is so important for them to be able to do that. Everything is done in one day. So your procedure's done in just one day. The temporary teeth, which are acrylic, they're placed. Now your final teeth, your permanent teeth, they're made out of zirconia, and we don't want to make those until the implants have totally healed and your gums have totally shrank and went through that process and they're stable. The zirconia teeth are made to those, and those are typically made around the 6-month mark. So your first appointment, the consult, is a 1-hour appointment. And what we do during that is we get this ICAT, which is a CT scan of your face, and we sit and look at it together. So you look at the same CT scan I'm looking at, and I show you how I can put your implants in, where I'm going to put your implants, so you know what I'm going to do on a really detailed level. And I know pretty much exactly what size implants I'm going to place, where I'm going to place them, and pretty much anything I need to know from a surgical standpoint, I know from sitting and talking to you during that 1-hour consult. So here's two of our coordinators, Shauna and Debbie. Shauna's in the blue shirt, Debbie's in the black blazer. They've both been doing this for years and years with us. They're both very knowledgeable, and a lot of times they can even save you a trip in. You know, if you have questions about the procedure, then I would urge you to call and talk to them and get their opinion. They've been very well trained in this, and they've got a lot of knowledge about the implants and the procedure. Our restorative team, this is Dr. Nafala and Dr. Dibbs. Both of these people have been doing this procedure with us for years, and I would be willing to bet and guess that there's not a dentist in the country that has done more of these implant retained bridges than either two of these guys. They're really, really good at what they do. Sometimes, you know, it's cool to have two different people doing them. So, you know, if Dr. Nafala has a question, he can consult with Dr. Dibbs. Dr. Dibbs can consult with Dr. Nafala. And, you know, they keep each other on their toes, but they also keep each other pretty much in tune with any new technology that's out there. So if Dr. Nafala hears about something, you know, he talks to Dr. Dibbs about it, they look at it, they research it. Is it something we need to bring into an air lab? And if it is, then we do that. The same with Dr. Dibbs. He's going to meetings constantly when he has the time to do so. And, you know, he'll bring back an idea. He's like, hey, I saw this. You know, I think we ought to talk about this. I think we ought to try to do this. And if it's something that is better for our patients, then we definitely implement it here. And you're going to hear a video of Dr. Dibbs kind of walking through what he does from a restorative standpoint. So we'll go to Dr. Dibbs.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient, that you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years, bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Okay, so you got to hear from Dr. Dibbs. And, you know, this is my surgical staff, and you will definitely get to know me and my girls when you come in to see me. You know, it is a very big building, a very big practice, but it's got that small town feel to it, and that's the way we want to keep it. That is Sherry, Corey, Amanda, and Alyssa, and all four of those girls have been with me for a long time. They're really good surgical assistants, and they actually are very helpful to our patients too. When you come in for your post-op appointments, they can talk to you and spend a little bit more time with you about, you know, what to do and what they've heard patients tell them that works for them to help them clean, and, you know, what they should be eating and their diet during the recovery and all the, you know, the good stuff like that. So here is our anesthesia team, and both Kim and Jack, you can see they've got a lot of years of experience. They're super talented from an anesthesia standpoint, which is what we want in our office, because we want it to be as safe as it can be for our patients. And they can help walk you through, especially if you are kind of a dental phobia patient, you're scared, you know, they're very good at helping treat our chickens. So make sure that you call and we'll get you hooked up with Jack or Kim. So here's our office. It's in Lakeland, Florida. And like I said, it's a big building. We got a really big team. That includes our restorative teams, that's our surgeons, that's our assistants, that's our insurance department, our scheduling department, our administrative, and the lab. And once again, if you guys have any questions, we're going to be on here for a few more minutes. Definitely submit those, or make sure you write down that number at the bottom of the screen. You can give the office a call tomorrow. We're on a few, you know, our hours are somewhat limited due to, you know, not being able to do elective procedures right now because of the coronavirus. But we do have schedulers in the office, and they can help answer any questions or get you scheduled. Thank you guys for joining us. If you have any questions, call and talk to one of our coordinators.